Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about scars and how to treat them. I'd like to start by stating that scars are each unique. Each and every scar is different. They are all caused by different types of trauma to the skin on different people in different locations at different times. No two scars are the same. So when somebody asks for advice about their scars, it is really very dependent on that individual scar. We will get into the specifics, but there are two things that I can say that are universal for scar treatment. And one is to keep the scar out of the sun as it's healing. Whatever that takes, whether it's a hat or clothing or a Band-Aid or sunblock, but you do not want to get sun on the scar as it's healing because it will typically make the skin much darker and then it will take a lot longer for that darkness to fade. The second thing that is universal about scars is that it's best to treat them early on. I typically will start treating scars if I'm going to treat them within about 4 to 6 weeks of whenever they began with the trauma. So I like to see patients fairly quickly after there has been trauma to the skin to decide what to do about the scars. We can help older scars, but it's easier to help scars when they are young. So I will often have a patient get permission at their post-op visit, if it's a surgical scar, for me to be able to start treating them about 4 to 6 weeks after the insult to the skin that caused the scar. So let's get into descriptions of different types of scars. And then we can talk about how to treat them and minimize them. A scar is by definition permanent. So right away, if I'm using the term scar, I cannot totally remove it. Scars can be improved but not erased per se. Scars are formed from trauma to the skin. It could be surgical trauma, could be a dog bite or a car accident, could have been a fall and a deep scrape of the skin. The skin is amazing and that it regenerates and heals itself, but if the trauma is deep enough, a scar is formed. In the scar, the collagen is not normal. It can either be too little or malformed and atrophic or indented, or it can be too much, as in a keloid or hypertrophic scar that are bumpy. But the collagen is not normal, and that's what we are often treating when we are trying to improve a scar. There is also often discoloration, whether it's lighter or darker than the normal skin tone, and we can also treat that color change. So let's talk as if a person is coming into my office for a scar consultation. First things first, I look at the scar. I ask what caused it and when, and I assess it. Is it indented? Common with acne scars, for it to be an indented scar, meaning it dips into the skin and causes a shadow. If you want more information on acne scars, there is an entire podcast that I did on that topic, which is very large. But today we are just talking about all sorts of scars, but acne scars are a common sort of indented scars. But back to general scars. If it's not indented, is it flush with the surface of the skin? Is it elevated above the skin? Where is it on the body? I assess the size, the color, the location. Is it atrophic or hypertrophic? And is it red or not red? Scars usually start out red. The red is showing the inflammation created by the trauma to the skin and the healing process. Sometimes extra blood vessels can be created and they grow. And we often call that redness post-inflammatory, which means after the inflammation. So after the trauma that caused the scar, the skin is red. It's a shadow of where the inflammation was, and it's part of the healing process. Once I have assessed the scar, now I need to figure out if I can help the patient improve it. There are a few easy and obvious things that a dermatologist can do for specific attributes of scars. The easiest thing to do is that if the scar is red, a pulse dye laser or other similar device can be used to reduce the redness. I have the V-beam laser, that's the brand name, but generally speaking, it's a pulse dye laser. KTP lasers, sometimes intense pulse light can help with this. And I will often treat the scar with my laser once, twice, or even 3 times, sometimes even more. The laser would be at monthly intervals, and I cannot do this if there's any sun on the scar. What the laser does is it helps remove the redness faster, but as the laser energy is taken up by that healing skin, it really helps that collagen remodel more normally and often helps the skin heal better. So it's a very easy thing to do. It's quick. It's like a little rubber band snapping. It takes a few minutes, and it's not that expensive to do. If the scar is not red, this laser will not work, which is why I prefer to start treating scars early on in their life when they are still red. So best to see a dermatologist for a consultation at that time. Now, the next thing that's very easy to do is if the scar is elevated, such as a hypertrophic scar or a keloid scar, which are more common on the upper trunk, upper back, jawline, but you can see this type of bumpy scar anywhere on the body. This type of scar will do well with injections of a steroid. Again, best to do it when the scar is young and forming as opposed to when it is a few years old. But as long as it's still inflamed, usually a little bit red, it will be helped by steroid injections if it's bumpy. And I will do these at monthly intervals. And this can take many months to be fully effective. So the laser I'll do 2 or 3 times usually. Occasionally more, but not usually more. But when I'm doing injections, it's usually months on end. 3, 6, 10, 12 months, a lot of months of injecting a bumpy scar. Sometimes 1 or 2 treatments is enough, but if they're really, really bumpy, often you need more treatments than that. This is also not particularly expensive, fairly easy to do. It only takes a few minutes. It feels like a little pinch. It's not particularly uncomfortable. Now, if the scar is atrophic, meaning that it is indented or flat, then a resurfacing laser would be indicated. I use the Fraxa laser, but there are many, many lasers that would work in this instance. And the idea is to basically create new trauma underneath the surface of the skin and get the collagen to remodel better. Again, this is going to work better on younger scars. Once a scar has been there for a year or longer, it's not going to work as well. I'm not going to say it doesn't work at all because it does, but it's easier if you do it when the scar is younger. It hurts a little bit. I will typically do a numbing cream. I would do this once a month for 3 months or so, occasionally more than that, minimum 3 in a row. It's usually red for a few days afterwards. Again, I don't want to do this if the scar is going to be in the sun, but this is fairly easy to do and to tolerate. What about scars that cannot have any of these treatments? I would also assess them for scar revision, and that would be done by a plastic surgeon. It's always a trade-off. If the patient is willing to, and we think it would be a good idea, they will be trading one scar for another scar. The plastic surgeon has to cut the scar out, and in so doing, they will be creating another scar. There is no guarantee that the new scar will be for sure better than the old scar, but there are instances where this will be helpful. And if that's the case, I will send the patient on for consultation with a surgeon about doing a scar revision surgery. There are also other treatments for scars, such as microneedling, and this creates microtrauma to the skin to try to get the scar to heal better and can be helpful in certain cases when done properly. I tend not to do this because I get great results with the other things that I mentioned, including lasers, and I don't feel the need to re-traumatize the skin so much when I have lasers that are so safe and effective. But microneedling can be helpful in certain instances, and it is often less expensive than laser. There is also microchanneling of different topical medications that some doctors do, where they use a laser or microneedling to create little open channels to try to get medications into the scar to help it heal better. And there's also PRP, or platelet-rich plasma therapy, where we take the patient's own plasma that has a lot of growth factors in it and inject it into the skin. These last two I would consider fairly experimental. Sometimes they may help, but there would be no guarantees. I tend to like to do things that I know are going to work, so I tend to stick with lasers, injections, and things like that, but there are other options if necessary. Let's discuss the color of scars. Sometimes scars are lighter than the skin. That is very hard to treat, but if they are darker than the skin color, we can treat that with either creams to bleach it or chemical peels. If you're interested in hearing more details about how to treat hyperpigmentation generally, please go to that podcast. There is an entire podcast on treating hyperpigmentation. It's really its own topic, but I will often do bleaching creams or chemical peels if somebody has hyperpigmented scarring. Now let's discuss scar creams. Usually, somebody has trauma to the skin and they are panicking because they don't want a scar. And sometimes we know that there's going to be a scar if there's surgery or if it's been a very deep cut or laceration or abrasion. And sometimes we're not sure, and people want to do everything that they possibly can to prevent it from scarring. My advice is to use basic first aid and let whatever scar it is heal normally, which would be Vaseline, Aquaphor, preventing infection. Sometimes you need to cover it. Sometimes you want to leave it open. Each scar is individual and unique, and I would use basic first aid. And if you're not clear, seek medical attention with either your dermatologist or urgent care. But all of the scar creams on the shelf that say that they're going to prevent scars, I think mostly don't do much. And so I'm really not a fan of them. I don't think that they're harmful. So if patients want to use them, go ahead, but I don't necessarily recommend them as the scar is healing. Once the scar has formed a bit and is healed, let's say maybe 4 to 6 weeks, sometimes retinoids can be helpful. Those are usually best done under the care of a dermatologist with a prescription Retin-A. So occasionally Retin-A, but again, the most important thing in terms of a scar cream would be sunblock and keeping the scar out of the sun. Most of the scar creams, I think, really are sort of neutral at best. I'd also like to mention silicone gel sheets, which can be found at pharmacies or online. Basically, they come in a big square, and you can cut them to be the size of the scar. And you would wear it like a bandage overnight or sometimes 24 hours and change it when you shower. They're commonly recommended to put on scars to try to help the scar be more flat and not get bumpy. And they can be helpful, but they also can be a little pricey. So another alternative, if they're too expensive, would be just a plain Steri-Strip or surgical tape. These are all assuming that the patient has no allergy to adhesive, because these have adhesive on them, and that does not irritate the skin. But these can be helpful. I don't think they're the be-all or end-all, but they do have a role in scar treatment. So in summary, scars are each unique. They are easier to treat when they are younger and still forming in the first few months, up to a year or so after the trauma to the skin has occurred. Older scars can be treated, but it's more difficult to make a difference when the scar is old. The most important number one rule is keep the scars out of the sun with whatever method is necessary to do that, including clothing, hats, bandages, sunblock, etc. If you have a scar that you want treated, I would see a great Board Certified Dermatologist to get advice. Any Board Certified Dermatologist should be able to help with fading creams if the scar is hyperpigmented and injections if the scar is elevated. If you are interested in having lasers used for your scar treatment, then look for a board-certified dermatologist who also does laser therapy. The lasers for these scars are fairly standard, so most dermatologists who do laser, which is not all dermatologists, but many dermatologists do lasers, should be able to handle it. This is something that's best treated with a dermatologist when you're trying to evaluate for scar treatment. So there are lots of options, lots of treatments, and if you're interested, see an expert for a consultation. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.